Hello. So I know we have been talking and everybody is talking about the COVID or the SARS-2, the disease itself and the treatment and the vaccines and the how to prevent it. Since in December we got the vaccine, first made by Pfizer, then by Moderna, and now again in some other countries other vaccines are released. A lot of people have a lot of questions and I'm sure the answers are available on web. But I thought I will put my couple of cents worth of it into it. So number one is that the first two vaccines that were approved, the Pfizer and Moderna, are kind of novel type of vaccines. This is called messenger RNA vaccine, and there are lots of questions that people have. Messenger RNA vaccine is a messenger to the cell to make a protein which looks like or belongs to the virus. So when you get the vaccine, not a single part of the virus is injected into you, not alive, not dead, not virus. It's just a message that is given to the cell to make the protein that looks like a virus. I have compared this to the police asking their dogs to smell a clothing or cloth that is used by the thief or culprit, and then the dog can find out just because of the smell. Something similar to that I can say this vaccine is where you inject the messenger RNA enclosed into a fat, and that goes into the cell. The cell produces a protein. The protein is exactly looking like that or spike protein of the coronavirus. The body thinks that it is the virus, and so it produces antibodies, and that's how you get the immunity. Both the vaccines need 2 doses. So I'm going to do this like a question and answer type of thing. So number one is the vaccine, does it have any part of the virus? The answer is no. Number 2 question would be, can you get viral infection from injecting this messenger RNA into you? The answer is no, because this is not a live attenuated virus or even any part of the virus. So you cannot get viral infection because of the vaccine. Number 3, why are there 2 doses? The Pfizer is 21 days, Moderna is 28 days apart, because the first vaccine initiates an immunity response, and that is boosted by the second dose. Somewhere between 70 to 95% is the first and the second dose response, according to what I understand. So the first vaccine offers some people protection, but the response is not as great. It is boosted by doing the second dose. So we need 2 doses. Pfizer vaccines is given 3 weeks apart. Moderna is given 4 weeks apart. What is the success rate of the vaccine? About 95% protection. Again, this is based on how many people in a vaccinated group got the disease and how many people in non-vaccinated group got the disease. Each group had roughly about 2,000 patients and 20,000 patients, not 2, I'm sorry. And then the incidence was rather low, so this may change over a period of time, but certainly it appears to be a great. Next question is, somebody who has had a COVID vaccine, would he get infected? Yes, the COVID vaccine does not protect you from catching the infection, but because of the quick antibody response, because the third time if somebody is exposed to the same protein, the viral protein, the body will shoot very high, the antibody titer will be protected. So yes, you can be exposed to it, may catch it, but the response of antibody will prevent you from getting serious disease or getting sick to an extent if you did not get the vaccine. So yes, you can still have some chance of getting disease, but not as bad, as severe, or as deadly as if you did not have vaccination. Next question is, does regular COVID infection, can it cause antibody response? And if so, somebody who has had infection, should he get the vaccination? The answer is yes and yes. That means Yes, anytime you have any infection, you're going to get antibody response unless your immunity is tremendously reduced or immune response is suppressed. So yes, the COVID infection will cause the antibody response. Somebody who has significant exposure to a virus, they will get a more response. Somebody who has a smaller exposure to the virus, smaller dose of the virus by natural infection, they will get the response. It may or may not be as big. The studies have shown the antibodies are, I think, about 73 days. You still have about 50% of the antibodies. I think the recommendation as it currently stands, anybody who has an infection should also consider getting the vaccine, but should wait for a little longer time. Mentions of 3 months is what I recollect. Because if you are re-exposed to similar type of protein, your response will be high, and you already have the antibody, it may not be effective. So that's why this particular recommendation is there. So yes, people who have had infection have antibodies, but they should consider getting vaccine in 2 to 3 months. Probably 3 months is the best thing. Can somebody who is infected with COVID, after 2 weeks, if they are still positive on their PCR test, should they still be isolated or not? I would say that they should still follow the precautions, but they are shedding the virus, and the PCR is extremely sensitive test, and so it will catch it, but the virus load will not be enough to really cause infection. The CDC recommendation as it stands is 10 days after the first exposure, or when you have no fever, couple of more days, you should be isolated. Maximum 14 days. If you continue to have symptoms, then 21 days is the latest recommendation as I understand it. But certainly 2 weeks is enough. And please note that just because you had the infection and you're cured, or because you had the vaccination and you have antibodies, does not mean that you should not follow social distancing or mask. You must wear mask and you must use social distancing in spite of having had a disease in the past, having had antibodies in the blood, and having had vaccination. So yes, the antibody titer does protect you, but you still can get a milder disease. The vaccination side effects are mild. The second dose vaccination side effects seem to be a little bit more, and I think that may be related to the viral, the response is higher, so people have more of myalgia, fever, not feeling good, etc. One of the other questions that comes in, which is usually from patients who have cancers or who have immunotherapy, immunosuppression, should they get the vaccine? The answer is yes. The only problem is if they are immunosuppressed, the response to viral vaccine may not be as high, and they certainly should get both doses and should certainly follow the recommendation of wearing the mask and social distancing even after getting the vaccine. Again, if somebody is actively getting chemotherapy and has low counts and problems, they should check with their oncologist as to what would be a right time or appropriate time to get the vaccination. But yes, the presence of cancer or immunosuppression is not a contraindication unless it is actively at a level where they may not produce the antibody. As I said in my first comment, the vaccine does not have any part of the virus, so it can never cause a disease even if you have zero immunity. But if you have significantly suppressed immunity, you may not respond to the vaccination, and you may have false sense of security that you are protected when you actually may not have been protected. So this is a summary of vaccine-related questions. I hope you like it and subscribe. Please note that the information is always changing. Please change CDC records and information on the web. Thank you. Have a nice day.